On this case, we're going to replace some old PFMs that the patient has on tooth number 8 and 9. You can see they're kind of high value, and we've definitely got some gingival problems as well. And to make this exciting and just to kind of show what we can do, we're going to replace these with some all-ceramic crowns. Specifically, we're going to make BruxZir crowns for teeth number 8 and 9. And you can see on the lingual here where the patient has either worn through or the laboratory has fabricated some metal runways for the patient. And as we get a closer look at the gingiva here, you can see that we definitely have some issues. It's swollen, it's edematous, and it looks like it's just ready to bleed. But first things first, need to take the shade before the teeth become dehydrated and start to appear higher in value than they really are. So we're going to the two adjacent teeth, the lateral incisors, and I'm getting a 2M1 for my 3D Master Shade. As you know, I love the 3D Master Shade Guide because it's so much easier to match to natural teeth. As you've heard me say before, it's laid out logically and scientifically and very easy to use. This is the linear guide. It's just 2 steps to get to that shade. So here are the 6 different shade guide families here, and it's already told us that the number 2 shade value is the one that we're looking for as I hold it up to these teeth. And you can see that it looks pretty nice. 3 definitely looks to be too low in value in shade family 1. Looks to be a little too light, but certainly closer than 3 is. And there's the 2M1 shade tab right in the middle. I've got the 1M1 on one side and the 0Ms over on the other side, just to kind of give you an indication of what we're talking about. But as you look at the 1M1 and the 2M1, I think the 2M1 is more correct. That's what the Easy Shade Compact told me was a more correct shade in the spot where I happened to put the tip of it. But the 1M1 is kind of in the ballpark as well. So I'm going to hold both of those here next to that tooth, the 1M1 and the 2M1, and take a photograph. My assistant will take a picture. We'll send it to the technician. That's going to help ensure that we get the best shade. That is a really important step here in terms of making sure that these 2 crowns on 8 and 9 are going to match 7 and 10. You've got to take a picture with that shade tab in place. Even though 2M1 might be the closest shade and 1M1's relatively close as well, they need to see those shade tabs next to those other teeth. And boy, look at that. Look at this. I told you the gingiva didn't look healthy. What do you think when you put topical anesthetic on gingiva and it starts to bleed? And this is really just from the tip of that brush kind of bumping up against the gingiva. So we've got some really inflamed edematous tissue here. These teeth have both been endodontically treated. So rather than give this patient 2 infiltrations, which will be somewhat painful underneath her nose, probably the least comfortable place to get an injection, I'm using my STA device from Milestone Scientific just to get some soft tissue anesthesia for the cord packing and the crown removal around these 2 teeth. So there's really no need for me to knock her lip out and get her nose numb and go through all that with a typical infiltration when the teeth have been endodontically treated. So I just go into the facial sulcus at the midpoint of the tooth, and I'm going to give about a quarter carpule on both of these teeth. You can see how the blanching actually moves interproximal to the 2 papillae, and it's been my experience that when I use Septicane in the STA system like this on anterior teeth, that I do get enough bleed through of the Septicane onto the palatal tissue, onto the lingual, where I don't have to give additional anesthesia to pack either of the 2 cords on the lingual. So we start to cut these crowns off so we can see what's going on underneath. You know, part of my thought was maybe this is an allergy to base metals, but as I cut through, it doesn't seem like it because I can see that these are in fact CapTech crowns, and I've loved and used CapTech for many, many years as an aesthetic PFM on anterior cases just like this because of the fact that the CapTech metal actually is beneficial to the gingival tissues. For that to happen, you have to leave a metal collar essentially underneath the gingiva to take advantage of the antibacterial properties of the CapTech metal, and that was not done in this case. It was just a porcelain margin, but still, it's not like if you cover the CapTech, you're going to cause anything bad to happen. You're just not going to get the good anti-plaque effects of the CapTech. So it's a little hard to say what was going on here, whether it was an open margin or if it was grossly over-contoured or there was cement left underneath there. It's really hard to tell about. The only thing we can conclude is that it was not probably a base metal reaction because we had the 22 carat CapTech coping underneath these crowns. So it certainly wasn't the metal. that was causing this issue. You could see they on the posterior now that we know these are CapTech, that the laboratory did probably put those metal islands in on the lingual on their own, because a CapTech crown, obviously, if you wore through it on the lingual, you would get right down to that soft CapTech coping, and if you were able to wear through it, and it would fall apart at that point. So I'm just going in and probing, sounding down to the bone here, to making sure we've got more than 3 millimeters, so I can go in and remove a little of this tissue without causing any kind of biologic width invasion. So as I go around and see that I'm okay to take off, half a millimeter or a millimeter of tissue, whatever I need to do, I'm going to go in with my diode laser, and I want to just get this unhealthy tissue out of here. Again, when I take a little topical anesthetic and a micro brush, and I just rub it up against the tissue to get some anesthesia there, and it starts to bleed all of a sudden, you can tell that we have an issue. It's one thing if you snap floss in between teeth, obviously, and it starts bleeding, but just to put a little topical in a little microbrush and to have the tissue start bleeding that much, there's something going on. And I want to recontour this tissue anyway, and I just want to get rid of that super unhealthy tissue. Hopefully get a nice set of temps on that's going to let this heal a little bit better. And then we'll come in next time and finish off the preps and take our impression then. This has been one of the things that I've learned in 20 years of doing dentistry, is that you can't always take the impression even though you have the time to take it that day. Even though you say, oh, shoot, we've got, a whole hour and a half blocked off or something like that. You're compromising this case, in my mind, to try to take this impression today. It's very difficult to get a clean, dry environment to be able to do that, for one thing. And it just seems like the chances of us having a really accurate impression and some really accurate crowns, it goes down the drain. It's just really difficult to pull all of that off. So I'm going to clean off some excess cement at this point, and I'm just going to drop my margins down a little bit to the area right where the free margin of the gingiva is right now. And of course, these are endodontically treated teeth, so I can turn off the air and water if I want to, which I typically do, but I can run it in the handpiece a little bit faster if I want to, just because I don't have to worry about frying a pulp. You've seen me do this all the time on vital teeth as well, where I turn off the water. But I do leave the air on, and I do turn the speed down to about 3,000 RPM so I don't generate a lot of frictional heat. But this is really where you get to see what you're doing at the margin. You get a good idea of how your margin's shaping up, how much you've reduced, how smooth it is. I'm not going to worry about any of that smoothing right now on this appointment. I'm just going in and cleaning off old cement, dropping my margin down a little bit to the new gingival level, because I do still want to have a slightly subgingival margin. Again, I know the metal wasn't the issue because it was a CapTech crown, but we are going to do an all ceramic crown, and I do want to have this facial margin just slightly subgingival, and we do that, of course, with the two-chord technique and without having to take a burr subgingival at any point. So really, this appointment has just become doing the majority of the prep work, just getting the most of the tooth shaped, getting the margin dropped, getting everything where I want it, getting the incisal reduction correct, and then making the temps. And so really, next time, all we want to have to worry about is taking off the temporaries, and hopefully the tissue looks nice, and then we can go in and do what we need to do to get our final impressions and move on at that point. So I've got some biotemps that I've ordered from the laboratory. Teeth number 8 and 9 are splinted together. If we did these as individual temps, obviously much better chance they're falling off. You can see me kind of pushing it very gingerly into place, not wanting to push it on too far and affect the tissue too much. I just had the patient bite together to make sure it's down all the way, but I was trying to basically make sure that I didn't jam a lot of material and then didn't trim it against the tissue itself. So we just put them in, pump them in a couple of times to make sure it's going to go into place and not lock down. Just relined these with Luxatemp, and then we're going to go in and do a little shaping on these. The shaping of the embrasures on these biotemps, especially in the anterior, is really important because we want to give a nice smooth surface here, and we even put a little glaze on it. We use a little Luxa glaze at the same time to get a nice smooth sealed surface as best as we can, so we have an area where the tissue can kind of heal around it. So if anything, we want to over trim these embrasures just a little bit. In other words, the dreaded black triangle that we always try to avoid when we're putting in permanent restorations, it's okay to have those black triangles with the temporary end. And we tell the patient, because we've left this little space for you, if it happens, then you can rinse back and forth with this dental herb company tooth and gum tonic without having to go in there and floss it. And that's going to make sure the gums stay healthy. So if we do have black triangles, we tell them it's in order to keep them from having to floss, and so their gingiva will be healthy and there won't be any black triangles in the final result. So